Hello, my name is Sarah Rodriguez, and today I will talk a little about the wounds. The wounds are injuries that break the skin or other tissues of the body include cuts, scratches and bites on the skin usually occur as a result of an accident but surgical incision, sutures and stitches. We have all suffered some kind of injury at some point, and for that reason I will tell you what types of injury exist. Okay, depending on the depth of the wound, it can be superficial when it only goes through the deep skin, when the wounds go through the penetrating subcutaneous tissue, when it penetrates cavity such as the buccal, abdomen, the vagina, and other. Perforating is when it crosses the body.
Hi, my name is Fernanda, and I will talk about how to heal deep, penetrating, and piercing wounds. First, you have to wash your hands with a soap or an antibacterial. If you don't do this, your wound will get infected. So try to do this first step. First, you have to wash your hands with a soap or an antibacterial. If you don't do this, your wound will get infected. So try to do this first step. As second step, you have to wash the wound with mild soap and water, and this is to prevent infections too. Then you have to use direct pressure to stop the bleeding in the wound. Finally, apply an antibacterial ointment and a clean bandage that doesn't stick the wound. And these were the steps to heal the deep wounds. So I'm gonna talk you about penetrating wounds, and the first second steps is the same. You have to wash your hands with an antibacterial or with soap. This to prevent the infections, and wash the wound with mild soap and water, and you know that this is to prevent infections too. Then use direct pressure. For example, if this is the wound, you have to do this, something like this, to stop the bleeding. And until you do this, you have to apply an antibacterial ointment too, and a clean bandage to that doesn't stick the wound. And finally, I will talk how to heal piercing wounds. Then apply pressure for a few minutes with a clean cloth or a bandage if you had it. This is to stop the bleeding. Then, if the bleeding is profuse, Apply pressure for a 5 to 10 minutes without stopping to observe the cut. If the cloth becomes soaked in blood, you have to place a new cloth over the old one. Don't remove the first cloth. When the bleeding has stopped, you have to wash your hands and the wound area with soap and water. Don't scrub it, okay? Finally, cover the area with gauze or an adhesive bandage. And this is all for my part. And thank you for your attention.